My name is Boon Lim. I'm a cardiology consultant at OneWelbeck, and we're going to talk about the single most important thing that will extend your lifespan. What is that? Exercise. How do you exercise to promote longevity? Now, I consider exercise as a pyramid consuming 80% of the time that you should be in exercise. My view is that you should do low intensity, high volume work. For example, walking briskly. Now, if you're going into the gym, you can set your treadmill or your rowing machine or whatever it is you choose to get you into a state of constant exertion that allows you to maintain a conversation. Now, not so comfortably, but not so uncomfortably that you have to catch your breath all the time. So zone 2 exercise is the building block. 80% of your time should be spent there. The other 20% should be spent in what's called high intensity interval training. Typically, we expect patients to push very hard for 3 or 4 minutes, recover for 3 or 4 minutes, push again for 3 or 4 minutes, recover in 4 cycles. And if you're doing that just for half an hour or a 40-minute session once a week or once a fortnight, that improves what's called your VO2 max, which is said to be the single most important parameter or metric that you can measure, which correlates well with your life expectancy. And that's just cardiovascular. The second bit of exercise that you need to be trying to do twice or 3 times a week is strength training. So that's pull-ups, push-ups, working with weights or squats. And you don't have to have fancy equipment or go to the gym. Just squatting 20 times times 4 on a day that you're working on strength of your lower limbs and doing push-ups will be sufficient, but keep the strength going. The third component is flexibility or stretching. And this is what you should be doing at the beginning of every one of your exercises, incorporated for free to give yourself sufficient mobility so that if you were older and you fell onto the floor, there is a way that you can pick yourself up. In summary, exercise has 3 components: cardiovascular, divided into zone 2 workouts and high intensity interval training. Number 2, strength training, critical to give you the body mass and the muscular strength to pick you up if you fall. And number 3, flexibility.